In this video, we're going to discuss pharmacokinetics, Unit 2 of Pharmacology. So, what is pharmacokinetics? Pharmacokinetics is the study of movement of drug within the body and focuses on the change in drug concentration in body over time. It involves examining the time course of drug absorption, distribution, metabolism, and excretion, as these factors all affect the concentration of drug in the body. A drug therapeutic effect is typically related to its concentration at the location where it acts. You can here see a flowchart of drug biodisposition where drug is administered, then it is absorbed into the plasma, and then from there it is distributed to the tissue around the body. Drug permeation. Factors that affect drug permeation are solubility, ability to diffuse through lipid bilayers. Lipid solubility is important for most drugs. However, water solubility can influence permeation through aqueous phases. Next is concentration gradient. Diffusion down a concentration gradient, only free unionized drug forms contribute to the concentration gradient. The third one is surface area and vascularity. Important about absorption of drugs into the systematic circulation. The larger the surface area, the greater the vascularities, and the better is absorption of the drug. Next is ionization. Many drugs are weak acid or weak bases and can exist in either non-ionized or ionized form in equilibrium depending on the pH of environment and the pKa value. Only the non-ionized or uncharged form of a drug crosses the biomembrane, whereas the ionized form is better renally excreted because it is water soluble. So, for weak acid and bases, ionized is equal to water soluble drugs and non-ionized is lipid soluble drugs. Ionization and renal clearance of drug. Only free, unbound drug is filtered. Both ionized and non-ionized form of a drug are filtered in the renal clearance. Only non-ionized form undergoes active secretion and active or passive reabsorption. Ionized forms of drugs are trapped in the filtrate. Acidification of urine will increase the ionization of weak bases, thus it will increase the renal elimination. Alkalinization of urine will increase the ionization of weak acids and then increase the renal elimination, as you can see in the diagram. Next is mode of drug transport across a membrane. There are three modes of drug transport across a membrane, which is passive diffusion, facilitated diffusion, and active transport. Passive diffusion and facilitated diffusion is always down the gradient. They don't require energy. Passive diffusion don't have carrier molecule, or they are not saturable, while facilitated diffusion is do have carriers and they are saturable. Active transport happens, the direction of active transport is against the gradient or against the concentration or electrical gradient. They do require energy because they are against the gradient and they have carrier molecules and they are saturable. Drug absorption. As we said before, drug absorption take place in four steps. Number one, absorption, distribution, metabolism, and elimination. Starting with absorption. Absorption concerns the process of entry of drug into the systematic circulation from the site of its administration. The determinants of absorption are those described for drug permeation. Intravascular administration or IV does not involve absorption and there is no loss of drug and the bioavailability is 100%. With extravascular administration or intramuscular subcutaneous administration, less than 100% of dose may reach the systematic circulation because of the variation in bioavailability. Let's look at factors affecting drug absorption. Number one, effect of pH on drug absorption. Drug absorption is determined by the pH at the site of absorption and by the strength of weak acid or weak base. Blood flow of the absorption site is another factor. The intestines receive much more blood flow than does the stomach, so absorption from intestine is more superior over the stomach. Total surface area available for absorption. With the surface rich in brush borders containing microvilli, the intestine has a surface area about 1000 folds that of a stomach, making absorption of drug across the intestine more efficient. Next is contact time at the absorption surface. If a drug moves through a GI tract very quickly, as can happen with severe diarrhea, it is not well absorbed. The presence of food in the stomach both dilutes the drug and slows the gastric emptying. Therefore, a drug taken with a meal is generally absorbed more slowly. Expression of P glycoproteins. P glycoprotein is the transmembrane transporter protein responsible for transporting various molecules, including drugs, across the cell membrane. It is expressed in tissue throughout the body, including the liver, kidney, placenta, intestines, and brain capillaries, and is involved in transportation of drug from tissues to the blood. That is, its pump drug out of the cell. Thus, in area of high expression, P-glycoprotein reduces the drug absorption. In addition to transporting many drugs out of the cell, it is also associated with multi-drug resistance. Next is bioavailability. Factors affecting the bioavailability includes number one, first pass hepatic metabolism. When a drug is absorbed from the GI tract, it enters the portal circulation before entering the systematic circulation. If the drug is rapidly metabolized in liver or gut wall during this initial passage, amount of unchanged active drug entering the systematic circulation is decreased. This is referred to as a first pass effect. Solubility of drug. Very hydrophilic drugs are poorly absorbed because of the inability to cross lipid rich membranes. Drugs that are extremely lipophilic are also poorly absorbed because they are insoluble in aqueous body fluids and therefore cannot gain access to surface of the cell. For a drug to be readily absorbed, it must be largely lipophilic yet have some solubility in aqueous solution. This is one of the reasons why many drugs are either weak acids or weak bases. Next is chemical instability. Some drugs such as penicillin G are unstable in pH of the gastric content. Others such as insulin are destroyed in GI tract by degradative enzymes. Nature of drug formulation. Drug absorption may be altered by factors unrelated to the chemistry of the drug. For example, particle size, salt form, crystal polymorphism, enteric coating and presence of excipients. Step number two in absorption of drug in the body is drug distribution. Drug distribution is the process by which a drug leaves the bloodstream and enter into the extracellular fluids and tissue. For drug administered IV, absorption is not a factor. The distribution of a drug from the plasma to intestinium depends on number one, cardiac output and local blood flow. The rate of blood flow to the vessel-rich organs like brain, liver, and kidney is greater than that of a skeletal muscles, adipose tissues, and skin. Next is capillary permeability. Capillary permeability is determined by capillary structure and by the chemical nature of the drug. Number 3, binding of drug to plasma proteins in tissue. Binding to the plasma proteins put the drug in a non-diffusible form and slows its transfer out of the vascular compartment. While the binding to the tissue protein will accumulate the drug in tissue, leading to a higher concentration in tissue than in intestinal fluid and blood. Drug may accumulate because of the binding to lipid, proteins or nucleic acid. Drug may also undergo active transport into tissues. Tissue's reservoir may serve as a major source of drug and prolong its action or cause the local drug toxicity. Next is lipophilicity. Chemical nature of a drug strongly influences its ability to cross the cell membrane. Lipophilic drugs readily move across most biological membranes. These drugs dissolve in lipid membrane and penetrate the entire cell surface. Lipophilic mean lipid loving. The major factor influence the distribution of lipophilic drug is blood flow to the area. By contrast, hydrophilic water loving drugs do not readily penetrate cell membrane and must pass through cell junctions. Then we have volume of distribution. The VD of a drug represents the degree to which a drug is distributed in body tissue rather than the plasma. VD is directly correlated with the amount of drug distributed into the tissue. A higher volume of distribution indicates a greater amount of tissue distribution, and the volume of distribution has an important influence on the half-life of a drug. Any factor that increases the volume of distribution can increase the half-life and extend the duration of the action of drug. Step number 3 is metabolism. Drug metabolism is the metabolic breakdown of drug, usually through specialized enzymatic reaction in order to increase polarity of a drug, so it can be ready for elimination from the body. Phase number 1 in drug metabolism is it convert lipophilic drug into more polar molecule by introducing or removing a polar function group such as OH or NH2. Phase 1 reaction usually involves a reduction, oxidation, hydrolysis. Metabolism may increase, decrease, or have no effect on pharmacological activity in phase 1. Phase 1 reaction most frequently involved in drug metabolism catalyzed by cytochrome or P450 system. The P450 system is important for metabolism for many endogenous compounds and the biotransformation of exogenous substances. Then we have phase 2 reaction. In phase 2, this phase consists of conjugation reaction. If the metabolite from phase 1 is sufficiently polar, it can be excreted by kidney. Glucuronidation is most common and most important conjugation reaction in phase 2. The last step in drug absorption in the body is drug elimination. Elimination is the process of removing the drug outside the body. A drug must pass through several processes in kidney before it is eliminated. Number 1, glomerular filtration. Drug enter the kidney through renal arteries which divide into to form a glomerular capillary plexus. Free drug flow through the capillary slits into Bowman space as part of glomerular filtrates. The GFR is normally about 120 ml per minute but may diminish significantly in renal disease. Lipid solubility and pH do not influence the passage of drug into the glomerular filtrate. However, variation in GFR and protein binding of drug do affect this process. Then we have proximal tubular secretion. Drugs that were not transferred into the glomerular filtrate leave the glomeruli through efferent arterioles. Last is distal tubular reabsorption. As a drug moves towards the distal convoluted tubules, its concentration increases. A drug, if uncharged, may diffuse out of the nephric lumen back into the systematic circulation, manipulating the urine pH to increase the clearance of an undesirable drug. Generally, weak acid can be eliminated by alkalinization of the urine, whereas elimination of weak bases may be increased by acidification of urine. This process is also known as ion trapping. This brings us to the end of Unit 2. Thank you for watching. If you like my video, don't forget to subscribe for more.